Well, we do have a healthcare crisis in America, and it's being worked on in the federal government. We have a healthcare crisis in the city of Houston. I think the first thing is the mayor's got to know what the issues are, have a technical background that makes him an effective leader, and bring people together to get better results in our city, particularly for indigent families and for children. We need a legislative agenda, but we also need to work with the other agencies of government here to perhaps consider some innovative solutions, like a pool, in a larger insurance pool where we can offer affordable insurance and access to health care to every citizen, every family, and a network of neighborhood health clinics is something that I'll talk about a little later in the program, but that's what we need, access to health care in neighborhood health clinics.
Certainly, we're in the midst of a healthcare crisis. The mayor of this city can play an active role in two areas. First, we can fight for healthcare access for all Houstonians. That means partnering with Harris County, making available federal dollars available, expanding the network of clinics, and making sure that our health department works in partnership in conjunction with other agencies. So that's an active role for the government, one level. The other level, though, is that the mayor has to lead the charge to educate people on wellness, to lead a campaign to get us to take care of ourselves. In the 1 minute that I have, I won't have enough time to talk about that, but these two things go hand in hand. It's both providing the access to health care and changing the attitude of people about their health care. In a nutshell, it's taking ownership of our own destiny. And I'm a big proponent of that, and I'll fight for it, and I'll use the center stage as the mayor's office to advocate for both of those, more health care availability and better ownership of the problems that we are confronted with.
Well, I think the first thing we need to do is look towards corporate America. They're already fighting disease and striving for better, healthy employees. That's what we need to do with the city of Houston first. We need to lead by example, and we need to go out there and we need to study the data within our own employees, because that's part of our problem right now, is that we have a health plan that is costing you way too much money. You know, some of the studies out there right now show that 5% of employees out there in the corporate world are really costing 80% of those health plans. We need to change that. We need to look at the data. Smoking, overweight, chronic diseases. Just look at the county's data. Heart disease, respiratory disease, diabetes. We can fight all that, and we need to change the philosophy on how we do that. And we need to encourage the employees, and I will create incentives within City Hall to make sure those employees become healthier.
City has three basic roles. One is an employer. We have somewhere north of 21,000 direct employees of the City of Houston. We need to make sure that the care available to them is the best possible. We need to work on programs for their health and wellness, and we do. Next is the city as a provider. We are the preventive care provider for the city for the Houston area. We need a seamless network of clinics, expanding our federally qualified health clinics, working closely with Harris County and the hospital district, encouraging the creation of more urgent care clinics. We have a significant role in that. And then finally, the city and the mayor as cheerleader and booster, from things like the Tour de Houston, getting people out and on their bikes en masse as we go through the city of Houston, to making sure that we have a connected network of bike trails in the city of Houston, anything and everything to get people out of their houses, off their couches, and out walking. The mayor has a big role in that. Thanks.